Hey there, San Diego. It's Andrew Bracken in for Jade Hindman. Today, what do cuts in federal funding mean for the future of HIV and AIDS programs around the world? Plus, how progress being made on a vaccine for HIV could be lost. This is KPBS Midday Edition, connecting our communities through conversation. For the past year, the Trump administration has cut off funding to programs that provide direct aid to communities affected by HIV and AIDS. That includes the dismantling of the U.S. Agency for International Development, or USAID for short, which provides a lot of that funding. John Cohen is a senior correspondent with Science magazine. He's been covering the global HIV and AIDS crisis for decades. While he's based in San Diego, he spends at least a quarter of the year going around the world on reporting trips and diving deeper into these issues. In May, he traveled to 2 countries in southern Africa to look at how these communities have been impacted by cuts so far. And John joins me now. John, welcome to Midday Edition.
Thanks so much for having me.
So on this recent reporting trip, you traveled to Eswatini and Lesotho. Why did you go to these 2 countries specifically?
So Lesotho and Eswatini have the highest prevalence of HIV of any countries in the world. And what that means is they have more adults living with the virus than anywhere else. They also have had 2 of the most remarkable responses to their epidemics, and that has been with help from the U.S. government, largely through the President's Emergency Plan for AIDS Relief, known as PEPFAR.
Can you walk us through more about what PEPFAR is and how
Sure.
USAID fits into this?
So PEPFAR was started by President George W. Bush, 2003, and it has received somewhere around $120 billion over the years to help more than 50 countries deal with their HIV/AIDS epidemics. Let's roll the clock back to 2003. At that period of time, it cost about $15,000 a year to treat somebody with the best HIV medicines for a year. So most of the world that's affected by HIV didn't have the money to pay for that. Those drugs became available in the United States around 1996. So we were watching people die from AIDS all over the world when there was good medicine that allowed people to live normal lifespans. And as we later learned, also hit the virus so hard that they didn't spread it to other people when they took these medicines. So it broke the back of epidemics. And then we learned that these same drugs, if people took them who were not infected, could protect them. It's called pre-exposure prophylaxis, or PrEP. So in comes the U.S. government, and there also was the creation of something called the Global Fund to fight AIDS, tuberculosis, and malaria. These 2 entities start around the same time. It leads to generic manufacturers to rush in to make these drugs. The price plummets to about $120 a person per year. And the U.S. government is able to help countries purchase the drugs, but more importantly, set up programs to distribute them, test people, monitor people, and make sure that the epidemics are declining.
So how reliant ultimately are countries like Eswatini and Lesotho for the treatment and aid that comes through PEPFAR?
Well, in the beginning, they were entirely reliant, but over time, they have taken on more and more of the responsibilities and the expenses themselves. They've had their people trained by these programs, and those people are training others themselves now. And they had hoped to phase out the PEPFAR funding by about 2030, about 5 years from now. In Eswatini and Lesotho, both countries are purchasing the bulk of their HIV medicines. So they're not reliant upon the U.S. government to buy the drugs any longer. It's everything else, what's called the wraparound services. And when I was in the countries, that's what I saw falling apart. The drugs are there. The issue is they have no impact if people don't take them.
So what did you specifically see on the ground in terms of how these cuts are, impacting these communities?
So let's start in Lesotho because that's where my trip began. And I went to a clinic where there were pregnant women lined up along the wall sitting on benches. And I talked to them, how long are you going to be here today before you see someone? And they said, well, at least 4 hours, maybe 8. The clinic had to fire a bunch of nurses. They didn't have the money. They were supported by PEPFAR. And a lot of these clinics also rely upon people who are living with HIV. They're called expert clients. And they do HIV testing and counseling for people. So they help them, if they are positive on the test, adjust to living with the virus. And if they're negative, they help them maybe start PrEP. They encourage them to do this. This clinic had lost that support as well. So these women who were pregnant were not receiving HIV tests. And when you break that down, stopping the transmission from a woman living with HIV who is pregnant to her baby is the greatest prevention campaign in the HIV world of all time. It works remarkably well. And the impact is the kids are born without the virus and they don't get it from breastfeeding. And before this, about 30% of these women were transmitting the virus to babies, creating whole new generations of infected people. We broke the back of that with this phenomenal prevention advance. That's not happening.
So how are, healthcare providers in these countries you visited navigating these new challenges now that it seems like, there are more these challenges for resources?
It's one thing when you don't know what to do. These are people who are really well trained. So they're frustrated. They're working longer hours. They feel betrayed in many cases. They came to trust the U.S. government and the allies and the programs supporting them. And they just can't believe it. They're just kind of dumbfounded as though they've been cheated on or something. And it's not as though they feel like we owe them. That's not it. We had made commitments. They were judged by their performance, and they were hitting milestones. So they're dumbfounded, and they're frightened.
So, these programs turned around the effect of the crisis in these countries that you report on here. Someone you spoke with was Nuha Sise, who heads the UN AIDS program in Eswatini. Here's a little of what he had to say to you.
This country was one time doomed to be completely wiped out, by HIV. But today, this is a country that is actually celebrating excellent results to demonstrate to the whole world that, if you really invest appropriately and you have the right programs, you can actually turn the HIV epidemic from a crisis to an opportunity.
So kind of illustrating your point there. And I think he mentioned to you he was even concerned whether that would be his last interview, I think.
It was his last interview. He subsequently had his office shut down because UNAIDS, a division of the United Nations, was receiving funding through PEPFAR, and that stopped. So here's a metric that's really easy to understand and underscores the success. With the help of PEPFAR and the Global Fund, the UNAIDS had set a goal that 95% of people in a country should know by the year 2030 if they are living with HIV. They should have tests and know it. 95% of that group should start treatment, and 95% of the people who start treatment should fully suppress the virus to the point that they're not going to transmit it to anyone else. Both Lesotho and Eswatini have already hit that 95 goal. Most of the world hasn't. These two small countries, 1 million to 2 million people, with the highest HIV prevalence in the world, with resource limitations that are profound, have both accomplished this. The danger now is they're going to slide backward.
So, as we mentioned at the start, you've been covering HIV and AIDS for a long time, for decades. And it's been so long, I think a lot of people may not remember the devastation that came from the AIDS crisis. Can you talk about, what it looked like then when you started reporting on this and how you're thinking about the past now as these new, programs are in jeopardy?
So I started really making HIV/AIDS my beat in 1990, so 35 years ago. At that point, if you were diagnosed with HIV, it's usually because you were sick, you showed up pretty ill. The treatments that were available would maybe buy you a couple years of life, but there were a lot of young people dying, really terrible deaths. And as I started traveling outside of the United States to places that were hit even harder, I would walk into hospitals and see dozens, if not hundreds of people in beds dying. And it was a war zone. It was tragic beyond belief. I would get depressed when I come home from these trips because I couldn't really process things while I was working. And it would wallop me when I got home what I had seen. And the way that you die from AIDS is it cripples your immune system, and you start becoming vulnerable to all of these bugs that don't do anything to healthy people. And you lose your eyesight. You lose your ability to feel the ground. You lose your ability to eat. It's just a horrific way to die. And this was happening to young people all over the world and destroying families and destroying communities. And to see the miraculous advance in 1995, 96 of these cocktails of drugs that let these people come out of their deathbeds and go back to work, go back to their families, create new families, to live normal lifespans was one of the most powerful examples in my life that I will ever see of what biomedical research can do.
And, kind of jumping off that point, how have more recent advancements in science changed the outlook for HIV and AIDS? I mean, there's been more recent drug breakthroughs that have just recently been approved by the FDA.
Yeah,
right?
There's a new form of PrEP that is an injection made by Gilead of a drug called lenacapavir that lasts for 6 months. So a shot will protect people from becoming infected for 6 months. It's not a vaccine, but it's the next best thing. It's a huge advance. And it's a new tool. This is kind of like birth control. When you want birth control, you want options. Some people want a pill. Some people want condoms. Some people want abstinence. Whatever you want to do, you have options. That's where we're at right now. The options have become more and more accessible to people. And there's also this enormous underappreciated spillover of what HIV research has done for other diseases. And front and center is COVID, the COVID vaccine. But still, we've seen new drugs come out during COVID that are based on research out of HIV. So it's had this spillover effect for biomedicine and for training researchers for many, many different infectious diseases that I don't think people really grasp. And San Diego is a hub of all this.
Yeah, let's talk more about that. We've been talking more globally and the impact, but what's the role San Diego's played here?
San Diego's had an enormous role in the epidemic. It has UCSD, Scripps Research, La Jolla Cancer Immunology. It has biotech companies and it has major pharmaceutical companies. They've all contributed a tremendous amount. The leading AIDS vaccine, HIV vaccine programs now in the world, one of them is based at Scripps, and it was just told that it's going to lose its fund, not be eligible for more funding from the NIH, because the NIH, for reasons that confound this research community, is cutting back funding at a time when they've made great progress. And it's a tough nut to crack, don't get me wrong. An HIV vaccine isn't around the corner, and there would be an HIV vaccine today if this were an easy virus to stop with an immune system. It's not. It's not COVID, which was a chip shot comparably. But you have to see this through the big picture, and what San Diego has done is played a critical role in helping to create new treatments and preventions that have been used around the world.
And coming up, we'll be talking more about, the HIV vaccine research coming out of Scripps, as you mentioned there. So, what do you ultimately want people to know about the impacts of HIV and AIDS, whether it's on a local or global scale?
Sure. Well, I think it's important for Americans to understand how grateful the world is to us for what we've done. And it isn't simply an act of charity. We have, through our foreign assistance and PEPFAR, a bipartisan supported program, saved an estimated 26 million lives. And as the UNAIDS country director, Niswatini, was pointing out, we've kept countries alive. And because of that, there's soft diplomacy where we've created goodwill toward us everywhere. And I think people who are against foreign assistance need to understand it's a tiny portion of the budget. It prevents the collapse of countries that otherwise might require us to come in with our military or other needs of support. And these viruses, as virologists love to point out, they don't know borders. They don't care. And if a resistant mutant crops up in Eswatini and Lesotho, it's going to be here soon enough. So the more that we work on this together and we behave as though we are connected to each other, the better off all of us are. And I think that's something that wherever you sit on the political spectrum, you have to appreciate there are things that connect us, and viruses do, and so do our responses to them.
Yeah, and I think, as we were talking before we started chatting here, I think a lot of us think about viruses, vaccines, all that's gone around much differently over the last half decade than we did maybe before. But this is something, again, you've been covering for several decades. I mean, what else do you think people need to keep in mind when thinking about these diseases, these pandemics, and the solutions that ultimately come about to save people from them?
One of the focal points of this project I'm working on, and I'm doing it with two other reporters on the science staff, one is working in Guinea and one in Nepal. So we're focusing on children and teenagers because it's about the future. That's what this really is about. When young people are sick with diseases that can be prevented, it is one of the most tragic things any of us have witnessed. And something I've learned after traveling to many countries to do my job, everyone everywhere wants to be healthy. There's no one who wants to be sick or wants their family to be sick, wants people they love to be sick. Nobody wants people to be sick. We all want health everywhere. There are lots of things we all don't want that some people think we should all want, justice or education. People argue against these things in places. No one argues against health. And I think the point that I really want to underscore is we have to invest in the future and take care of the children today. And I hope that everyone across the political spectrum, red, blue, whatever, sees that America has been a shining example of how to make a better future for the world.
I've been speaking with John Cohen, senior correspondent with Science Magazine. We'll link to his full piece at kpbs.org/midday. John, thanks so much for being here.
My pleasure. Thanks for having me.
When Midday Edition returns, how funding cuts risk the future of HIV vaccine research, including here in San Diego.
What it means is probably a huge setback in HIV vaccine work, probably setting us back a decade or longer.
That's ahead on Midday Edition.
Now on the Finest podcast, the NPR Tiny Desk Contest, we bring you the history of the concert series and the competition and hear from artists behind our favorite local entries.
We're just very tired of hearing music that doesn't represent the people or is very nonsense or just dumbing people down. People want to relate to the music that they're listening to. People want to hear people's stories or struggles.
Listen now wherever you get your podcasts.
You're listening to KPBS Midday Edition. I'm Andrew Bracken, in for Jade Heidman. We're covering how the Trump administration's spending cuts could impact the future of HIV and AIDS research. One critical aspect of that research looks into the development of a vaccine. Researchers were on the cusp of a major scientific breakthrough, but now are worried spending cuts could put their work and vaccine research as a whole in jeopardy. I'm joined by Dennis Burton. He co-leads the Consortium for HIV and AIDS vaccine research at Scripps, where he's also a professor. Professor Burton, welcome to Midday Edition.
Thank you.
So before we dive in, can you set the scene a bit for us? Where were you in your research when you found out funding may be at risk?
Yeah, so HIV is, one of the greatest problems in biomedicine. So it's caused us many, many headaches. But in the last sort of 10 to 15 years, we and others have focused on designing vaccines that induce the sorts of antibodies that can fight against HIV, so-called broadly neutralizing antibodies. And we've just started to have some real successes in animal models. And in the clinic as well, we're starting to see that we're getting the sorts of antibody responses that we want in small human trials. So we've been very excited lately that we're making accelerating progress, and we were looking forward to moving towards a vaccine in the next funding cycle from the NIH.
You mentioned these headaches that, working on HIV created and the complexities therein. Can you talk about what makes HIV so challenging to develop a vaccine for?
Sure. So it's not really even one virus. It's really hundreds of thousands of related strains. So the vaccines got to protect folks not against just one virus, as might be the case for some viruses, but against all these different strains. So the antibodies that the vaccine induces have got to be able to attach and take care of all these very, very different strains. And that means that you need very special antibodies and very special technologies to induce them. But we've kind of worked those out now to a large degree. So that's why we think we're really getting somewhere.
And so, with this progress that's been made on an HIV vaccine, does that potentially have implications for the development of vaccines for other diseases?
Yeah, I mean it has because HIV is probably the greatest of all vaccine challenges. It's forced scientists to innovate in a way that they've not been perhaps innovating before, challenged to do so before. So a lot of new technologies, new approaches, new ways of doing things have arisen. And as one example, the mRNA technology that has been so useful against in the COVID vaccine, but is now also finding applications in cancer, in advanced melanoma, and so on. This technology originally started with researchers working in HIV, and there are other examples of that.
So, how did you find out the NIH maybe pulling the plug on the program, the Consortium for HIV and AIDS vaccine research?
Yeah, so the program folks sent us an email and said, "Can you go on a Zoom call tomorrow?" So we went on the Zoom call, and they said, "Look, unfortunately, the planned next phase of this program is not going to happen. The upper management of NIH has decided to not continue with these efforts."
So, what exactly does that mean for your research going forward?
Oh, well, I mean, it's certainly going to curtail the research greatly. We're hoping we can continue at some sort of level with alternate funding, but that's very much up in the air. What it means is probably a huge setback in HIV vaccine work, probably setting us back a decade or longer. What it also means is the dispersal of these teams. I mean, we have, over the last two cycles of this program, we have assembled a team of scientists with very different expertises, and that's contributed a lot to success, is the fact that we bring together virologists and immunologists, structural biologists, computational biologists. We bring all these people together, and it takes time to build teams like that, and that's just going to be blown away now. Once you remove the funding source, then the teams get dispersed, and it's very hard to rebuild a team of this magnitude, of this different expertises.
And, 10 years is a long time. As you mentioned, it's kind of taking back a decade or more. Is there hope that, at least some of the vaccine research can be picked up from other countries or other research centers throughout the world could kind of pick up some of what you may be losing here in the United States?
It's possible. It's possible. The United States has always been the world leader by some margin in HIV vaccine research. And so that's, a big question. it's possible that China, that is investing a lot these days in biomedicine, that they may pick up on this at least to some degree, but that remains to be seen.
How important is international collaboration in this effort?
It's very important. I mean, most of our research is actually based in the United States, but what we have done is clinical trials we've done also in South Africa, which is the epicenter, or sub-Saharan Africa is the epicenter of the AIDS pandemic. And so that's been very important for the clinical trials, and it looks like that will all be lost now.
So there are, currently many treatments for HIV. Treatment for that
Hmm.
disease has come a long way. Can you talk about what makes a vaccine so critical in your view?
Yeah, I mean the breakthroughs in drugs have been, fantastic and have saved millions of lives. And the latest development, the long-acting antiretroviral drug lenacapavir, is a huge advance. But these drugs still cost money, and they and people have to take them. So they still have some strong limitations. And I think most folks, even those who have been, who've shown the drugs are effective, they are still of the view that if we want to eradicate HIV, if we want to really control this virus and eventually get rid of it, then we're going to need a vaccine. And I think that's true of, many diseases, that the best way to control them is complete and utter prevention. And that's what vaccines do. And they're cheap, relatively cheap. And, if it's a really good vaccine is one shot and you're done and you're hopefully protected for life. And that's what we want to do. We want to give folks freedom from HIV for life.
Now, zooming out a bit more on just vaccines more generally, earlier this month, U.S. Secretary of Health and Human Services, RFK Jr., gutted the CDC's independent vaccine
Mhm.
advisory panel, removing all 17 of its members and bringing in new appointees, some with more anti vaccine views. What concerns you about the Trump administration's stance on vaccines and what it could mean for the future of vaccine research?
I mean, I think vaccines are, the two medical interventions that have done the most are for human health are clean water and vaccines. And they have been so successful. In a way, they're victims of their own success. I mean, can I ask you a question?
Go for
How
it.
many people do you think died of smallpox in the 20th century?
Oh,
And don't be shy, because many colleagues get that wrong.
smallpox in the 20th century?
Yeah,
200,000.
the answer is about 300 million.
Oh, wow.
The answer is about 300 million. So it's a very, very large number of people. And after 1978, no one on Earth has died of smallpox.
Wow.
No one, because it was eradicated. And most people believe that eradication was due to vaccination programs that got rid of the virus entirely. So we just don't have to worry about it anymore. That's how powerful vaccines can be.
So, in spite of these setbacks to your research, I'm just curious, how you and your colleagues are navigating these challenges. I mean, how will you be approaching your work moving forward in this particular environment?
Well, it's difficult. I mean, because of the uncertainties as well, the uncertainties of what's happening are having a lot of effects. We can't, nobody knows if they're going to have a job tomorrow. It's difficult to recruit people now. We get some of the best minds coming from different foreign countries. They are not going to come if the conditions look to be as difficult and uncertain as they can. So I think we're in a stage of trying to work out how, we want to keep moving forward. We want to, do our science and do our work and make vaccines, but right now we're in a kind of limbo because there's so much uncertainty about what's happening. So it's a very bad situation in biomedical science generally in this country, which has been the world leader for so long.
Earlier, you mentioned how these spending cuts could set HIV vaccine research quite a bit, like 10 years, I think you mentioned.
Yeah.
But are you at all hopeful that the field can recover and build on the progress that's already been made? And if not, what will it take to get that back on track?
Yes, I mean, the progress is still there. The technologies that we've developed are still there, but reduced funding or no funding means that, things are going to go much more slowly. And, we've still got a lot to learn. We've still got to test different approaches, different candidates, and so on. And so we're not going to be able to do that. So the progress is going to be inevitably much slower. And as I said, the dispersal of the teams is also going to detrimentally affect the speed at which we can move forward. I mean, we're not going to give up. Nobody's going to give up, but it's just going to be much slower and much harder. And yeah.
I've been speaking with Dennis Burton, professor of immunology and microbiology and co-lead of the Consortium for HIV and AIDS vaccine research at Scripps. Professor Burton, thank you.
Thank you. My pleasure.
That's our show for today. I'm Andrew Bracken. KPBS Midday Edition airs on KPBS FM weekdays at noon, again at 8 p.m. You can find past episodes at kpbs.org or wherever you listen. Thanks again for listening. Have a great day.
Now on the finest podcast, the NPR Tiny Desk Contest, we bring you the history of the concert series and the competition and hear from the artists behind our favorite local entries. Listen now wherever you get your podcasts.